What if all along science was looking for the root cause and we ignored it? I'm Dr. Tracy Tyson, I'm a board certified general pediatrician, and all I hear on social media is that doctors just want to keep you sick. Doctors just want to make money off of you being sick and write prescriptions and all of these things. And I do understand where that comes from, but let's take a look at it from a little bit different perspective. Public health in general's job is to be kind of behind the scenes where you don't really necessarily notice what they're doing. They're doing things like trying to get chemicals out of your water and screening for lead poisoning so that we can catch it early before children have developmental delay. Asking the USDA to put certain vitamins that are deficient in most populations into foods that have easy access and that most people are eating. All of these things that public health does, recommend vaccinations to everyone when it's been proven that that's really the only way to decrease it in the most high-risk populations. As those things go down, we start to notice that people start to question these policies more and see them as infringing upon their rights, or why are we even doing this? Why are we spending money on it? And the problem with this mentality is that when we don't allow the movement forward in science to stay the standard and we go backwards, we're not looking for anything new. So what was happening in science that some people were calling woke is that we were recognizing that adverse childhood experiences and where you're from and who you're born to and where you live, what environmental toxins are you exposed to, your education, your healthcare, your parental stress, all of those things had a bigger impact on your chronic health than almost anything else that we did. So a lot of our research the last 20 years has had words like race, diversity, equity, environment, a lot of these gender, because the issue was we were recognizing that the way to get it to the root cause of a lot of these illnesses were policies. So doctors like myself and scientists have become even more involved in public policy because where you live determines how long you'll live. Who you're born to determines how long you're going to live. And medicine wasn't always looking into that. Medicine is racist. I'll be honest with you. It doesn't always necessarily mean to be. It's who's paying for the research, who's doing the research, and not really understanding that the policies in place are hurting the most vulnerable. So this is probably one of my biggest concerns in public health right now, is that while we're cutting funding for looking at any of these root causes, while we are instilling more distrust into the medical community as well as public health, we're going to see an explosion of preventable illnesses at the same time as an explosion increase in chronic illness. While we have less healthcare providers, less infrastructure, less research, pharmaceutical companies are wanting to pull out of the United States. They're not going to want to start to develop new ways to prevent things if we're not going to use them. So there's a reason a lot of us are really fearful, and we're not trying to fearmonger. We're not trying to do anything except give you as much information as we can and let you know why we're scared. There's a reason why on my mornings off, I'm online. That is not because I'm getting paid for it. It's the exact opposite. I'm actually losing money to do this. But it's so important. And in order to move forward in healthcare at all, there has to be a coordinated effort. There has to be everybody working together for the collective good. There was a really interesting graph that I saw, and it talked about how those that were more interested in public health and advocacy and science thought of the world around them at the same amount that they thought of themselves and their family. Yet those who were less interested in science and diversity and equity and all those things only cared about the world around them after they cared about themselves and their families. And I understand where this comes from, but at the same time, it's hurting us. And we don't have to be that way. If your community is not safe, you're not safe. And I think we've learned that in the last few weeks. Doesn't matter where you come from. If your community is unsafe, you're unsafe. If anyone's child is unsafe, your child is unsafe. If anyone's child is unhealthy, your child is unhealthy. And pediatricians care about all kids. We don't just get to care about our own or just the patient in front of us, because the patient in front of us directly affects the patient that's coming afterwards. And I had a mom say to me the other day, and she started to get it, and then she kind of lost the point. She's very, very anti-science, and she doesn't want to hear any advice whatsoever that I have really about anything. And yet she made a comment that she had seen recently how much increase in child abuse there was going on, and that so much of that was being, seen at the pediatrician's office, and just how difficult that must be to go from a room like that where a child is being abused, neglected, not taken care of, and then go straight into another room and have to be your best self. And I wanted to kind of say, yeah, because that child's health directly impacts your child's health. And when that child grows up underneath poverty and abuse and all of those things, they're your child's community member. And that is going to increase problems in your child's life. The same goes with public health. If your child is healthy but not vaccinated for pertussis and spreads pertussis to 50 different kids, that affects your community. So we need to start thinking a little bit more globally and then back together. And every child should be our priority. And it is to your pediatricians. Take care.